All right, let me share my screen. All right, so journey to Medicare, the A, B, C's, and D of turning 65. Hello, everyone. My name is Laurna Bulahan. I've been with Colleen, Callahan Insurance Services for 3 years now. I think some of you might know who Colleen Callahan is. I started off with the agency as her assistant, helping with prepping meetings and presentations and helping out with applications. Since then, Colleen has retired and sold the agency to Heffernan Insurance Brokers. We are still doing business as Colleen Callahan Insurance Services. And when Colleen retired, she had asked me if I was interested in getting licensed, and I said yes. So I've been licensed since January of 2020 and have taken over the Medicare side of the business since then. A little bit about myself. In my spare time, you can find me in the kitchen cooking delicious foods for my friends and family. I'm doing a Peloton workout, watching a sports game, Go Niners, or playing with my 2-year-old rescue dog, Olive, and my new kitten, Mac. So without further ado, so the Medicare system can be extremely confusing and overwhelming for most. There are a handful of rules and options that one has to consider when they turn 65, not to mention insurance companies bombarding you with information when you near the age of 65. A majority of people who approach me about Medicare feel like this exact picture right here, a deer in the headlights. Or lost in a maze. They also feel like they're lost in a maze, not knowing which direction to take. So that is where a help from a Medicare broker like myself can be helpful. We help clients navigate through their options and recommend plans that fit their individual specific needs. So a little bit about the history of Medicare. Medicare was enacted as Title 18 of the Social Security Act to provide health insurance to people over age 65 and older, regardless of income or medical history. In 1972, Medicare added coverage for people with disabilities. And in 1997, the Balanced Budget Act of 97 created a Medicare Part C. Before it was called Medicare Plus Choice, but now it's called the Medicare Advantage plan. So who was the first beneficiary of Medicare? The answer is former President Harry Truman and his wife, former First Lady Beth Truman. They became the first recipients of the program. So here in this picture, you see former President Lyndon Johnson signing the Medicare Amendment, where he presented Truman with the nation's first Medicare card. So right now, we are at a time where people are rapidly turning 65 every day. So 10,000 people turn 65 every day. And by 2030, 80 million people will be in Medicare. So for those of you who are turning 65 this year, you are in good company. We have Joe Montana, Tom Hanks, Gina Davis, Randy Jackson. And the first Plato was released in 1956. So Plato is 65 years old this year. And then Elvis Presley also released his first hit back in February 1956. So what we will discuss in this presentation, first we will talk about how group employer benefits affect your Medicare eligibility and coordination of benefits. If Medicare is the route you're wanting to take, then we will discuss what your coverage options are, when can you enroll, how do you enroll. We will also discuss dental and travel insurance, and we end the presentation with questions. So if you're turning 65 and currently enrolled in your employer plan, you do not need to leave the employer plan when you turn 65 unless you choose to. If your employer size is less than 20 employees, then Medicare is primary and you should enroll when you're first eligible. If your employer size is larger than 20 employees, then your employer plan is primary and you can delay Medicare without facing a penalty. If you decide to stay on your group plan after you've turned 65, when you leave your employer coverage, you have an 8-month special enrollment period, often called an SEP, to enroll in Medicare. You typically do not have to pay the late enrollment penalty if you sign up during an SEP. So from there, you get 6 months from enrollment in Medicare to apply for a supplement or but only 2 months to apply for a prescription drug plan or Medicare Advantage plan from the time your enrollment ends or health insurance ends, whichever happens first. So as a reminder, if you choose to work past the age of 65 and your employer size is larger than 20 employees, please keep records of your health insurance coverage. A letter called Letter or Certificate of Credible Coverage will be needed when you're ready to apply for Medicare to avoid any late enrollment penalties. So this is an example of what the Letter of Credible Coverage looks like. The Certificate of Credible Coverage is a document that provides information whether an individual's current prescription drug benefits is credible coverage, meaning that coverage is expected to pay on average as much as the standard Medicare prescription drug coverage. You can also ask your employer's HR department director for more information. So here are some additional questions to ask. How big is my company? So knowing this will determine if Medicare or your group plan is primary and if you should enroll in Medicare when first eligible, or to keep records of your letters of credible coverage. Do you have children or who are under the age of 26 or a younger spouse who's enrolled in your employer plan? What are their options? Typically, we'll look at individual family plans for them, or your employer might offer COBRA for them. Are you currently contributing in a HSA plan? When you move to Medicare, you can keep what is already in your HSA funds, but you cannot add to it. And can you keep some benefits? So you can keep your dental vision employer plans if you still plan to work past the age of 65. Any questions? Okay. So who is eligible for Medicare? You must be a US citizen or legal resident for at least 5 consecutive years and one of the following: age 65 or older, younger than 65 with a qualifying disability, or any age with a diagnosis of end-stage renal disease or ALS. Next, we're going to discuss the Medicare coverage options. The parts of Medicare comes in letters. There's Part A, Part B, Part C, Part D, and the Medicare supplement, sometimes referred to as Medigap plans. So what are the different parts of Medicare? When you first turn 65, you are eligible for Part A and Part B of Medicare. Part A is typically free if you've been paying into Medicare taxes for 10 years. Part B is associated with a premium that we will discuss in a couple minutes. Once enrolled in both parts, you have 2 options. Option 1 here in red is to enroll in a Medicare supplement plan partnered with a prescription drug plan. Or option 2 is Part C or a Medicare Advantage plan. So this graph shows the same information as the last slide, but in different context. So there's original Medicare Part A, Part B on the left side with your Part D prescription drug coverage and then your Medicare supplement plan, or you can go the Medicare Advantage plan route, which is Part C. And then typically these plans include drug coverage, but if they don't, you can add prescription drug coverage to those as well. So when you turn 65, you enroll in original Medicare, which includes Part A and Part B. So Part A covers inpatient hospital care, inpatient mental health care, skilled nursing services, hospice care, some blood transfusions, and you can't be turned down because of pre-existing medical conditions or medical history. Part B covers physician services, outpatient hospital services, ambulance services, outpatient mental health, lab services, any durable medical equipment that you might need, some preventative care. Also, you can't be turned down because of pre-existing medical conditions or medical histories. And you can get Part B care throughout the US, but generally not outside the country.
Hey, Lorna, does the DME include like equipment for sleep apnea? You know, the CPAP
Yes.
machine? Okay.
Mm-hmm. Yeah. So durable equipment such as wheelchairs, walkers, CPAP machines, that sort. So costs for Part B, there's no out-of-pocket maximum. There is a co-insurance. You pay 20% of the Medicare approved cost. Part B, as I mentioned before, it has a monthly premium determined by your income, and you pay this directly to Social Security. And there may be higher premiums if you join after your initial enrollment period, which is the Part B penalty. So Part B is associated with a premium, and it's determined by your earnings. It's a 2-year look back. So in 2021, Social Security will look at your 2019 tax return and so forth. The standard Part B premium in 2021 is $148.50. Most people pay the standard Part B premium amount. And if your modified adjusted gross income as reported on your IRS tax return from 2 years ago is above a certain amount, you'll pay the standard amount and an income-related monthly adjustment amount. So if your earnings were above $88,000, then depending on how much your earnings were, you'll fall into this chart. So what's not covered by Part A and Part B? So Medicare Part A and Part B deductibles, coinsurance, and premiums. Medicare Part B excess charges. So these excess charges are amounts billed over what Medicare agrees to pay. For example, if you see a physician that does not accept Medicare, prescription drug coverage, additional benefits such as hearing, vision, and dental, and long-term care. So Part C of Medicare are your Medicare Advantage plans. So Medicare Part C combines Part A and Part B, and in many cases includes prescription drug coverage. These plans are offered by private insurance companies. In many cases, you'll need to use healthcare providers who participate in the plan's network and service area for the lowest cost. With these type of plans, you will need referrals from your primary care physician to see specialists. These plans set a limit on what you'll have to pay out of pocket each year for covered services. So here are some examples of some Medicare Advantage plans. You have your HMO, PPO plans, your special need plans, and then you have your private fee for service plans and medical savings account plans. Any questions? Let's check the chat. Okay.
I don't, this is Ann. I don't see anything in the chat. I kind of had a, could you go back to the slide? Go back 2 slides, I think. The one, no. Yeah, what's not covered?
So what's not covered is what
So
Part A and Part.
So my question was then how do you get hearing, vision, dental, and covered? Long-term care, you have long-term health care plans, but how do you go ahead and get hearing, vision, and dental covered?
So I have a dental slide towards the end of my presentation, but
okay.
A lot of Medicare Advantage plans do include the hearing, vision, and dental built into their plans. And then also some supplement plans have extra benefits, so hearing and vision. So
excellent.
There are ways you can get those extra additional benefits.
Excellent. Thanks, Laurna.
You're welcome. So next we will talk about prescription drug plans. So prescription drug plans are Part D of Medicare. So a little cartoon that depicts the complexity of the Part D plans. These plans are designed differently than how we currently know what our prescription drug benefits are. So it can get kind of confusing and overwhelming for a lot of people.
Laurna, I'm sorry to interrupt, but I don't want you to go too much farther. I did see a question in the chat. Can you give examples of Part C, HMOs, PPOs, and the rest?
An example would be like your Kaiser. So Kaiser is a Medicare Advantage plan. And then special needs plans, FNP plans, are if you have a certain like diabetes, there are special plans that are tailored to those who have diabetes or any sort of a complex thing like that. So the most common Medicare Advantage plans that I could share is your Kaiser. It's a HMO plan. So it's your managed care plan. So you work within a network with those type of plans.
What would like United Healthcare or Cigna or any of those, do those have Advantage plans?
Yes.
Okay.
So Part D helps with the cost of prescription drugs, and they may lower your costs and protect against higher costs. They're only offered through private insurance companies, and you must continue to pay your Part B premium. So understanding drug coverage stages. So Part D is a stage system. There are 4 stages in the Part D drug plan, and they are as follows. So there's the annual deductible stage. In 2021, that deductible is $445. Next is the initial coverage stage. The 3rd stage is the coverage gap, the donut hole. And then there's the catastrophic coverage stage. I don't want to go into too much detail, but the maximum deductible in 2021 is $445, and the donut hole is $6,550, meaning this is the amount that you would have to pay in the donut hole in order to move through to the catastrophic coverage stage. And the drug plans are tailored to your medication needs. So depending on what medications you take determines what level of the stage you are at different points of the year. So like the Part B IRMA, you may be subject to a Part D IRMA premium if your earnings were above a certain amount. Again, it's a 2-year look back. So for 2021, they'll look at your 2019 tax return. Consider it like a high earner tax for your drug plan. You will pay this in addition to your plan premium. So I like to put a slide about Goodrx. So Goodrx is a great resource if you have high cost medications. You can go on their website, type in your medication, and a list of coupons will populate for pharmacies in your area where you can get your medications at a discounted rate. You might have seen commercials for Goodrx on TV. They're a great resource. So you do not have to use your insurance for this if you fill via Goodrx, and it does not count towards your deductible. Any questions? Okay. So now we are going to discuss the Medicare Supplement Insurance Plans, or Medigap plans. So the benefits of moving to Medicare and a supplement. So you have your Part A and Part B original Medicare. With your Medicare supplement plan, it gives you the highest level of coverage. So it has Medicare Parts A and B. Part B requires a premium. These supplements are offered by private insurance companies. The plans are lettered A through N. Benefits vary by plan, and generally this combo is the more comprehensive the coverage, the higher the premium. With original Medicare and a Medicare supplement, you can use any doctor in the US that accepts Medicare assignment. There's no out-of-pocket expense, better coverage, lower cost, and you're eligible the first month you turn 65. So if you're ready for a educational presentation to help with, there's several Medicare supplement plans out there. I'll put my contact information at the end so you can reach out and we can discuss your options. So facts about the Medicare supplement plans. Generally, the best time to sign up is during your 6-month open enrollment period. Some states have additional or different open enrollment periods. It goes with you anywhere in the US, and it's guaranteed to continue as long as you pay your premium on time and have not made any material misrepresentation on your application. So here's a chart showing the different standardized letter Medicare supplement plans that are available to enroll and purchase and their benefits. So the richest plans and the most popular plans out there right now are the Plan S and the Plan G. These two right here. So did you turn 65?
Laurna, quick question, go back. So what's this, what are these two numbers at the bottom here? That 60.
That's the out-of-pocket limits in 2021 for any excess charges that doctors who don't accept Medicare assignment might charge you.
So once you hit, if you see a doctor that's outside of your Medicare or that doesn't take Medicare, you'd only be responsible for Plan K. And then Medicare would cover after that?
Yes.
Oh, okay.
Okay. So did you turn 65 before or before January 1st, 2020? So if you turn 65 after January 1st, 2020, that means that the Plan F, which is the richest plan available to purchase, is unavailable for you to enroll in. So the next best plan for you would be the Plan G. So if you turn 65 before January 1st, 2020, and you kept working, the Plan F is available for you to enroll. So they closed the Plan F for anyone turning 65 after January 1st, 2020. So just to give you an idea of what the monthly premiums are for the Medicare Supplement Plan G, various insurance carriers also have additional discounts available to you when you first enroll. So they have the Welcome to Medicare discount, an EFT discount if you set up to pay your premiums through autopay, and then household discounts. So if you have a spouse or anyone over the age of 65 on Medicare living in the same household, you can receive household discounts.
Question. Do those rates change if you start at 65 and you're paying 120 when you turn 75? For example, would you be paying 177 or do they stay the same? Or
the rates increase every year.
They do, okay.
Yeah, by age.
Okay.
And if you move. So the rates are determined by age and zip code.
Okay. Good.
So the difference between the Plan F and the Plan G, the Plan F and the Plan G are very similar to one another and are identical in benefits and coverage. So the only difference between the two is the Plan G has a 203 Part B deductible for 2021, meaning you'll need to satisfy the 203 deductible paying towards outpatient services, labs, anything of that sort. That falls under the Part B category before the plan starts paying. And the Part B deductible changes every year, so it will go up next year.
And that's an annual deductible or by?
Yes.
Okay.
Annual.
Okay.
So when should you sign up? You have a 7-month window to apply for Medicare when you turn 65. So that's 3 months before the month you turn 65, the month you turn 65, and 3 months after you turn 65. When you enroll in Parts A and Part B of Medicare, and then you receive your Medicare ID card, it's recommended that 1 or 2 months before your 65th birthday to meet with an agent to discuss your options and to sign up for a supplement, prescription drug plan, or a Medicare Advantage plan. So if you're not already receiving benefits from Social Security, you will need to sign up for Part A and Part B. You will not get Medicare automatically. So you can enroll in Part A and Part B of Medicare online on the Social Security website, or you can visit your local Social Security office to complete an application. So if you're leaving an employer plan, as a reminder, you may need to go into the Social Security office to apply, as they may require documentation from your employer, such as a form that your employer might need to fill out, and then also your evidence of coverage. So when can I change my Medicare plans? So you will have 2 opportunities or open enrollment periods every year. One for your Medicare supplement plan and one for your Part D plan if you're going that route. In California, they have what's called the birthday rule. So this allows you to switch and enroll in another Medicare supplement plan 60 days following your birthday. You do not have to go through medical underwriting to switch plans. The new plan does not have to be with the same insurance company, but it must have benefits that are equal or lesser than your current plan. If you decide to switch Medicare supplement plans outside of your birthday enrollment period, full medical underwriting is required. So you can enroll in a Medicare supplement plan anytime, but if it's outside an open enrollment period, you will go through full medical underwriting.
What's full medical underwriting?
They will ask health questions, and then they might request some medical records from your doctors.
And you can't enroll, you can't increase your benefit. You can only do equal or lesser.
Correct. So the Part D enrollment period takes place every year between October 15th and December 7th. If you decide to make a change, new coverage will begin January 1st of the following year. If you decide to enroll in a Medicare Advantage plan, you will have the opportunity to switch plans during the October 15th, December 7th period. There is also a general open enrollment period that takes place between January 1st and March 31st. So our office has the ability to do online enrollments, which makes applying for your Medicare supplement and prescription drug plans easy. No paper applications or needing to come into our office to complete applications, and everything can be done online.
There's a question in the chat, Laurna.
Sure.
Under what circumstances can you increase your benefits?
You cannot. So when you first enroll, you would have to enroll in the plan that gives you the best coverage and the best benefits. Your application will get denied if you try and increase, if you enroll in a plan that has more benefits than you're currently enrolled in. And there's another question from Linda. I have heard that if one initially signs up for a Medicare HMO and later decides to switch to original Medicare Parts A and Part B, there can be penalties or cost increases for the Part B. Is this true? Any other issues should be considered in weighing a transition from a Medicare HMO to original Medicare? Well, thank you for your question, Linda. So the Medicare enrollment periods and rules, they're pretty strict. So once you enroll in a Medicare HMO, and that's a Medicare Advantage plan, you do have 1 year to test out the plan, and if you like it, and if it's within 12 months of you enrolling in that plan, you can go back to original Medicare. There is another option during the open enrollment period. If your HMO plan either decreases in benefits or you move out of the service area, then you have the opportunity to move back to original Medicare. But there are no penalties or cost increases for Part B. The only Part B penalties would be if you sign up for Part B after your initial enrollment period. So dental insurance, decisions to make about dental. You can remain with your employer plan. You can take COBRA, or you can enroll in an individual plan. So Medicare doesn't cover most dental services. So if you're looking for coverage, it is recommended you either do one of these three choices. And when we can travel again, remember, or when it's safer to travel again, travel insurance. In most situations, Medicare won't pay for healthcare or supplies you get outside the US. There is a minimal travel benefit if you enroll in a Medicare supplement plan, but those benefits are only in emergent situations, and it does not cover everything such as evacuations. So it is recommended that if you are a Medicare beneficiary and plan to travel abroad, to purchase travel insurance. Your premium is determined by your age, length of your trip, and the deductible that you choose. And a little bit about Medicare and COVID-19. So Medicare covers the COVID-19 vaccine at no cost. Your Medicare Part B covers testing for COVID-19, and it also covers COVID-19 antibody testing. So that's it. Thank you for having me. I appreciate all of you joining in. At this time, we will take questions, and then I will put my contact information at the end right here, so you have it. And feel free to reach out to me with any questions you may have. I know Medicare is a second language. It can be confusing, so I'm here to help.
There's another message in the chat.
First, Laurna, do you want to unshare your screen so everybody can see everybody and ask questions? And
yeah,
I can send out your information as well. So
okay, sounds good.
Okay, who's got questions? There was one in the chat. Someone said there's another one in the chat.
William Bard, doesn't Medicare through Kaiser provide reimbursement for foreign emergency medical services?
That's a Kaiser specific question. And to be honest, that is one that I do not know. So our office primarily works in the Medicare supplement and prescription drug plan market. I do go through training for Medicare Advantage plans, but that is a Kaiser specific question that I don't have the answer to.
Just to chime in really quick, just so that everyone know, Kaiser is kind of like private. You have to go through them directly if you're going to do any Kaiser Senior Advantage plans. Whereas the others, Blue Shield, United Healthcare, it can go through a broker.
Thank you, Sonia.
Good to know.
Yeah, Kaiser won't work with any outside agents or brokers. They have their own team.
Anybody else? This is complicated stuff. Here we go. Darren asks, does a 2-year look back on income set the baseline for how much you will pay, or is there an adjustment after 2 years?
The Part B premium will adjust every year. So, and there is a Part B appeal process. So say 2 years ago you sold a home and it looks like you have, this huge income, and now you don't. So there is a Part B appeal process that you can go to lower that Part B premium.
Okay. Laurna, do you have some? I know we didn't talk about this because I didn't think about it, but will you be willing to part with the slides for everyone?
Sure, I can send you something that you can send to everyone.
Perfect, perfect.
Lorna?
There's one, yeah.
I wanted to see if you could make sure I understand this correctly. So when you turn age 65, regardless if you're going to stay enrolled in your group plan because you're still working, or whether you're going to leave the group plan. Maybe your Medicare's primary and you work for a company that's less than 20. Regardless, everybody needs to enroll in Part A and Part B at the age of 65, correct?
So if you are planning to work, and it's really the employer side. So if you have an employer less than 20, then it is recommended that you enroll in Part A and Part B. Part A, you will automatically get enrolled in at 65 if you've been paying Medicare taxes for 10 years.
Okay. So if you're going to stay working, you turn 65, you're with a 20 plus company, you don't have to do anything. You're automatically enrolled in Part A.
Mm-hmm.
And then you wouldn't enroll in Part B because you're still with your group plan. Is that right?
Correct. And
okay.
Yes. And if your employer size is larger than 20 employees, then you would have to get the evidence that you're on a group plan and make sure that the prescription benefits on that plan is credible.
Okay.
Mm-hmm.
And then can you explain the difference between Medicare Advantage plans and Medicare Supplement plans?
So Medicare Supplement plans give you the flexibility of physician choice. So you can see any doctor or see any providers that accept Medicare assignment. Medicare Advantage plans are your managed care, your HMOs. So you need to work with a primary care physician to get referrals to see specialists. So you have to work within a network with the Medicare Advantage plans.
So if you're on an HMO and you want to keep those same doctors and keep doing the same thing, then it would be the supplement. And did I get that right?
The Advantage plan.
Advantage.
If you're on Kaiser.
Okay. All
something like a Kaiser plan.
Okay. Okay. So here's another question. I missed that. It's from Linda. If spouses are covered under the younger spouse's employer health insurance, are there any special conditions for the older spouse as they sign up for Medicare?
So if your younger spouse, if you're on an employer plan through your younger spouse, then you can stay on that plan as long as the group plan is over 20 employees. And when you decide to stop working, or if your spouse stops working, then that gives you a special enrollment period to enroll in Medicare.
Okay.
So these plans renew every year. So you're looking at your medical insurance like every year, and that's the time when you like make a change, but otherwise you would be adjusting rates and looking at that each year.
Yes, on your birthday. Your enrollment date into the Medicare Advantage or the Medicare Supplement plans is a year.
Oh, good. Here we go. Here's a good one. Is it ever advantageous to enroll in Medicare Parts A and B when at 65 you have health insurance through a large employer, more than 50, and if one enrolls in Parts A and B while still employed at age 65, can better coverage benefits be obtained when one is no longer employed?
That's a hefty question, William. It is, if you are if your group employer is larger than 20 employees, more than 50, then you can stay on your group plan. But if one enrolls in Parts A and B while still employed at age 65, can better coverage benefits be obtained when one is no longer employed? I'm going to have to take down your contact information, William, and get back to you. I think I'm going to need to sit on that question.
Okay, good. Good.
So confusing.
He'll call you.
Yeah, give me a call.
Yeah, exactly.
Yeah.
Sorry, it's me again, Lorna.
These are
Okay, so
great
just
questions.
understanding like Medicare Part A and Part B. When you talked about 80% coverage, right? So 20% is pretty much your out-of-pocket cost. So getting a supplement or advantage plan is then essentially filling that in per se. So then you have that more 100% feel of coverage, or to put it all together.
Yes.
Okay.
So think of it, the Medicare Advantage plans combine Part A and Part B into their plans, and then also gives you the additional dental, vision, hearing benefits.
Mhm.
But think of it like a slice of Swiss cheese. So you have a block of Swiss cheese, and you know how there are holes in that block of cheese. The Medicare supplement plans cover those gaps. So that's why they're called also Medigap plan. So it gives you 100% coverage. So original Medicare will count for 80% of covered services, and then 20%. And then the supplement will cover 20%. So it gives you the highest level of coverage.
Gotcha. Thank you. That's always so confusing.
Thank you.
I'm figuring somebody else had that question in their head, right?
There's no whiteboard big enough for all of this, right?
Right? It just shows you. I mean, insurance is no joke. They don't make it easy for you. You know, once you turn 65, it's more complicated.
And most people don't know that there are insurance agents or Medicare agents like myself out there. So they try to navigate the system by themselves, and they read all this information online. And then the insurance carriers are, bombarding them like, join our plan, but you don't really know what you're signing up for. So that's why I'm here to assist and help out. So.
And we're grateful.
Thank you.
Someone to speak English to us.
Yeah. It's
right.
a second language, that's for sure.
Yeah, insurance. Yes, insurance definitely is the second language. I would agree with that.
Yeah.
Okay, anybody else? Think about it. You might have a question.
To us. Feel free to reach out to us anytime, because these questions might come up, later. And just remember, when, now when you're out there talking in the public with just yourselves or your coworkers, your family members, people a lot of times don't know what to do when they're turning 65. So feel free to just tell them, call Laurna, call Sonia, call Colleen Callahan Insurance Services, and we'll hold your hand and walk you through the process.
Yes. Thank you, Denise. Denise is my team member, so she's hyping me up.
Lawrence, Sorley, did you have a question, or are you just waving goodbye to us? Your hand was up.
I was waving goodbye and thank you.
Okay, thank you for coming.
I thought it was done.
I think we are. I just, I like to let it. Oh, wait, see, can you discuss primary versus secondary payments with Medicare? See, someone always thinks something. And now we're kind of just talking. So if, feel free to depart if you don't have any more questions or so.
Primary
Thanks again.
versus secondary payments. Thank you, Lauren. Appreciate it. Medicare or primary versus secondary payments with Medicare. Can you elaborate on your question, William? Is this something that you heard through a friend or something that you read? Not quite sure. So if one has insurance through an employee and also Medicare, you will have to use one or the other. So say you're on a group plan and you're also on Medicare, it's the coordination of benefits, they're separate. So that's why original Medicare is the primary. If you're on Medicare, original Medicare is the primary, and then your supplement is technically the secondary that picks up. It's the 80-20 balance.
Right. One pays first, the other picks up the balance. So here's the question, and I was going to ask this, but Joe brought it up. if we seek you out for your advice and consultation, is there a fee for working with you? And what might that be? Or is there a consultation? Then if we have you do the sign up, there's a fee. How does that work? And could you type your phone number into the chat for me?
Sure.
You guys, I mean, everyone will get their all the contact information in an email, but
I'll type in the office number in just a second, but fee is just sharing my name with all your friends and family. I don't charge for my services. If you do decide to go through a broker and we enroll in the plans, then we get compensated by the insurance carriers.
Right.
So your fee is sharing my name with all your loved ones. And then I'll type in.
The Colleen Callahan Insurance Agency has been helping us out for many years. So I've heard rave reviews about Laurna and her cohorts over there. and Colleen's retired now, but she's got a great group that she's working with her for many years. So we're pleased that we can still count on them. So.
Yes, Colleen has definitely has taken me under her wing, and I have been mentored by her in the last year. So anything that Colleen can present, I can present.
And I would agree, having heard both and worked with both over the years. So
yeah.
Okay, good. Okay, anybody? If I have private insurance and sign up for Medicare, who pays for hospitalizations, doctor visits, etc.? The private insurer or Medicare or both? And if one is both, are all costs covered?
If you have a supplement plan in original Medicare, then all costs are covered. So your private insurance you get your Medicare supplement plan through in private insurance. So original Medicare Part A and Part B plus your supplement gives you the highest level of coverage. So Part A covers your hospitalizations, your skilled nursing care. It's coordination of benefits are separate. So if you are on an employer plan and have Medicare, then you would have to pay that 20%.
Okay, well, I think I am going to, let's see. Oh, there we go. No, we're good. I think I'm going to, unless anyone has any more questions, I think I'm going to say thank you very much, Laurna and Sonia and Denise, for joining us today. Laurna, you did a great job, as I knew you would.
Thank you.
Yeah. So anyway, thank you, everyone, and we will get you the information and through email. Have a great rest of your day, everybody.
Great,
Thank you.
Bye-bye.